Hello anatomy friends, this is Dr. Alsup, and in this video we will be discussing the joints, and I'm saying joints, of the elbow region. Specifically, we'll actually name those major joints and discuss ligaments and other pertinent structures, and of course we will discuss actions and any pertinent clinical information. So there are actually three separate joints, all located within one shared joint or articular capsule in the elbow region. There is the true elbow joint, which is the humero-ulnar joint. This is what people are typically talking about when they say the elbow joint. The close humero-radial joint is, as mentioned, closely related and contributes to the actions of the hinge joint. So I do want you to be aware that it is here, but we're not going to go into any real details of the humero-radial joint. Lastly, there is the proximal radio-ulnar joint, which, as the name would suggest, is the most proximal of the three different joints formed by the radius and ulna. Again, even though this joint is capable of distinct actions from the humero-ulnar joint, it still is housed within the same joint capsule as these other two joints. So a bit more detail regarding the humero-ulnar joint. Again, oftentimes you just hear this referred to as the elbow joint. This is the very example of a hinge joint. Hinge joints are only capable of flexion and extension, which is certainly what is occurring at the elbow joint, so flexion and extension here. This clear movement is due to a variety of factors, including the articular bones, which really help to facilitate this movement. So you have this very spool-shaped trochlea articulating with a crescent shape kind of trochlear notch of the ulna, so really allowing movement in only one plane, so a uniaxial movement. The ligaments also play an important role in facilitating flexion and extension and allowing no other movements to occur, like much abduction or adduction. These collateral ligaments are strong triangular bands. So you have collateral ligaments are going to be located medial and laterally, and these are thickenings really of the fibrous layer of the joint capsule. And as I hope you would guess, the ulnar collateral ligament will be the medial one, and the radial collateral ligament will be the lateral one. Additionally, there are numerous bursae that are associated with the elbow joint. And the most clinically relevant are the olecranon bursae. So the olecranon is that big bump that you can feel on the back of your elbow region. So repetitive, excessive friction or pressure in the olecranon region can cause the bursa or the bursae to become inflamed, producing bursitis, particularly in the subcutaneous olecranon bursa. The other major joint I want to discuss is the proximal radio-ulnar joint, which is a pivot type joint. So you can see pivoting in this joint here. So during pronation and supination, that head, so the head is going to be deep to this annular ligament here, more to come on that in a moment. That head is going to rotate within the collar formed by the annular ligament and the radial notch of the ulna, which is located about right here. So it is the radius that rotates in this action. The head will rotate here at this joint, but there is also movement in the distal radio-ulnar joint. And so you'll have the radius rotating around the head of the ulna. In supination, as you can see here, the palm is going to face anteriorly. So we have the palm facing anteriorly or superiorly when the forearm is flexed. Whereas in pronation, the palm faces posteriorly. So you can't see the palm here because it's facing posteriorly, or it will face inferiorly when the forearm is flexed. And as you can see here, the radius and ulna are going to be parallel in supination, so an anatomical position, whereas in pronation, there is rotation of that radius around the ulna. And so that's really where pronation has that rotation of the radius. It's most often most visible when you're looking distally. Now a bit more about the annular ligament of the radius. So I'm going to outline it here. The annular ligament is very characteristically circumferential. So it's going to surround and form a collar with the radial head. So it's going to form a collar, it's going to be attached to the radial notch of the ulna, and it's creating a ring that completely encircles the radial head, allowing for efficient pivoting movement in that region. Now, a common injury in children, usually around the ages of 3 and 4, is the radial head being moved away from the annular ligament. So that annular ligament in development, particularly in those ages, the annular ligament is comparatively bigger than the radial head at this stage of development. So you can have subluxation, which is a partial dislocation, or a complete dislocation. And what typically happens is a kid is grabbed by the hand and quickly jerked. Say, think a kid is running into a parking lot and you're trying to pull them back onto the sidewalk. And what will happen is with that kind of jerking motion, it will pop the radial head out of place and or causing damage to the annular ligament. This is commonly referred to as a pulled elbow, or sometimes, unfortunately, you hear this referred to as nursemaid's elbow, but I wouldn't suggest that. Excellent. We have reached the summary slide. Please take time to review the big picture concepts as described here and reach out with any questions you may have. Thank you for your time and attention, and have a great rest of your day.